Let me actually formally welcome everybody for showing up to today's wellness webinar. This is our free monthly wellness webinar. Every month we put together a particular topic and we focus on different things to share, educational, informational, hopefully, and sometimes entertaining. And so this is the last one of 2025. We're going to continue doing this. I had toyed around a little bit a while back with like, do I want to keep doing this? Because these things are very time consuming. And I'm sometimes flying solo and sometimes I have nutrition students or interns working with me, but they can be a little bit overwhelming. But I think it's just always important, at least for my goals, and I'll share a little bit about who I am in a second, that I really want to put good quality content out there and a variety of it. So today's conversation is going to revolve around what we call complementary and alternative medicine. You might hear me using the acronym CAM and what that means, some definitions, concepts, and objectives of the webinar coming up on the next video or two, just because I think it's important to understand and recognize there's a variety of different ways that people can implement ways of healing themselves, or if they're dealing with a particular chronic condition that feels very overwhelming, they might not love getting conventional treatments, or they might want to think of something that could be used in adjacent to help support them as they're managing or supporting whatever treatments they're going through. And so hopefully some of your takeaways that are listed here at the end of our webinar, which is what I hope for you. Going forward, just some housekeeping things. So, I mean, if you've been attending these webinars before, you kind of know this is the same stuff that happens all the time. You probably heard on your way in that the session is being recorded. That's for a variety of reasons. Like I said, not everybody who registers can make it in person. So I send out the recording within a handful of days or so after the live event to anyone who's registered. And then in a couple of months, I queue this up and it publishes to the DishWithDina YouTube channel so that it's publicly available. And it's, again, a nice library of topics, which I'll share a little bit too at the end of today's webinar. I'll share a little bit too about what else is available that you can check out. You can use the chat box at any time. You can also obviously keep yourself muted and keep your cameras off if you don't want to be, being published or available on the video here. But we usually have some time for Q&A at the end. And as always, this is just educational, informational for you, not to be used as medical advice. Please make sure that you are talking to somebody with treatment, whoever's treating you for your particular conditions, or if you plan on starting or stopping a particular regimen. When you register for these webinars, we do collect your email, obviously, because that's how we get in touch with you and send you the links. So that goes into a database, and then every month I send out a newsletter and I keep you posted as to what's going on in the world of Dish with Dina things, and also share with you, like I said, the recording for this and any of the future events that we're going to have coming up. So on that email list, if you ever feel like opting out, you can, totally fine. You have the option to do that. But right after today's, or within a couple of days of today's event, I will send out the recording and it'll have a link to a survey. We always love getting feedback from all of you, whatever you're interested in, how you think we did. And I say we because, like I said, sometimes I'm working with nutrition students behind the scenes or interns who are helping me put all this stuff together. And we love to see what you're interested in. So let's talk a little bit about who I am. If you've never met me before, I'm Dina D'Alessandro. I have a Master of Science in Nutrition, and I am known as a registered dietitian or a nutritionist. They are kind of interchangeable in our world. On screen, what you can see, there are all of the things that I have been doing or have done in the past that kind of make me who I am. I'm a second careerer, so I didn't start out with my college degree as going into dietetics. I went back to school at the tender age of 43 and started a whole new career for myself. And this is where I've been ever since. So where I'm coming to you right now is live from Lehman College campus up in the Bronx in New York City. This is where I am an adjunct lecturer of both undergraduate and graduate nutrition studies, but I'm also the campus dietitian here at the Student Health Center. What I wanted to share a little bit, though, is because we're going to talk about some of these alternative methods of treatment and different practitioners in the health and wellness space. So I just want to kind of give a quick overview as to what a registered dietitian is and what qualifications we have. So we have a protected title. So we can call ourselves other things if we want to, but nobody can call themselves a registered dietitian or a licensed dietitian unless they've gone through the particular process that we have, which at this time is getting a master's degree, going through a whole year-long dietetic internship, and then taking a board certified state exam, and then making sure that we're also continuing our education and qualifications. Every 5 years, we have to renew our cycle of continuing education units. We have state licensures and different kinds of regulations that we have to abide by. And then if we are seeing patients, like in the case of what I do here, but also in my private practice, if we are working with health insurance, we have to make sure we're abiding by ethical billing practices and making sure we're doing the proper billing and coding so we can get reimbursed. And so our patients can also see us within whatever their health insurance plan eligibility or coverage is. So on the bottom there, not all dietitians are necessarily nutritionists or health coaches, but we could call ourselves that if we wanted to. A lot of the stuff that we are qualified and have been educated to do can allow us to go into those fields. But not every health coach or somebody who calls themselves a nutritionist will be a properly credentialed or qualified registered dietitian or other language that might be used in the health and wellness space. So I'll talk a little bit more about this in later in the webinar just to give some education to everybody. So if you are working with practitioners outside of the traditional clinical realm, then you know what it is that you're looking to ask them. And I think a lot of times when we talk about CAM, right, complementary and alternative medicine, we're taking more of a holistic approach. And a lot of people who are in, the doctor, nurse, dietitian world, sometimes we come across as a little bit clinical, but thank goodness the newer generation of who we are does include taking a more patient-centered approach and more whole person approach as to our management treatment plans for whoever we're meeting with. So let's talk a little bit too about what these definitions are. As you can see, sometimes you might hear a combination of these things: complementary, alternative, integrative, and functional. And really what it means is just providing you with something outside of the traditional or conventional methods. Like instead of pharmaceuticals, there might be more diet plan regimens or other kinds of treatments available that can help people with managing their symptoms or put them on, again, maybe like a pain-free approach to whatever their clinical condition is. It could be a non-mainstream practice that's used either in addition to or sometimes instead of. But really, the main goal, I think, of a lot of these approaches is to focus on that root cause. Like, what is it that these symptoms keep coming up? What is the problem? What's the purpose of this? And it all keeps coming around this word called balance. So I'm going to talk a little bit about that too in a second. But before I go into the next slide, if you want to share in the chat, again, no pressure, but if you want to share in the chat, good afternoon, hi Far, you can share with me what comes to mind when you think of things like complementary and alternative medicine. What do you think of when you hear that language or that terminology being used? And I'll give you a sec if you want to chime in the chat. Just, think of any treatments or things that you've heard of that kind of fall in line with this category. And in the interest of time, because I always overpromise and over deliver when I do these webinars. So to keep us on track, here are some examples of some of these more like holistic approaches or these treatments. So you have things like acupuncture. I think some of you have heard of a lot of these things too, right? Yoga, massage therapy, mind, body, energy healing. I mean, a lot of aromatherapy, all of that stuff that just kind of sometimes qualifies as like self-care or wellness approaches, but can be used in tandem with our conventional or traditional methods as well. So I want to take us a little bit back. Now, for those of you who were my students, back when I was teaching, oh gosh, was it like Intro to Nutrition, DFN 220, whatever that one was, where we did society, food, society, and health. We took a whole world view of what nutrition is and was way, way back in the day, adopted by the ancient Greek and Roman physicians like Hippocrates, if you've heard that name before, the father of modern medicine. There was something called the theory of four humors, and this has to do with these fluids that are in our body that the concept around it is kind of like these elements or related to seasons, like what, like you see there, right? Water, fire, air, and how our body over time shifts and how sometimes there's an imbalance in that. So the reason we get sick is because our body isn't in alignment or isn't in balance. And so we in the Western world, we kind of did away with this a little bit. We ended up going a little bit more sciencey in that respect. But I'll talk a little bit more about the language that I'm using too, because I don't necessarily want to negate a lot of these thousands of years old approaches and remedies that we're going to see coming up in some of the examples that I'm giving you. So one of them related to this is known as the hot and cold therapy. So in this approach, there's this discussion again around the elements, and our body has different fluids and systems involved in it. And so things are categorized as either hot or cold. Yes, sometimes temperature, but more so there's just a category, like something brings a heat to the body or something is bringing a coolness to the body. And so this, I think, was also brought in by Mexico and Spaniards as well. So Mexicans and Spaniards in the Arab system as well. So hot and cold approaches, when we apply remedies like this and we treat it with food or treat it with some other type like herbal remedies and things like that, we're treating a hot condition with a cold remedy and a cold condition with a hot remedy. So I don't have a slide that lists this out. Now that I think of it, I probably should have done that, but I'm going to read you some examples of exactly what that means. Don't ask me the logic behind it. It's based on ancient theories and philosophies. But as an example, a hot illness could be something like a fever. That makes sense, right? Redness, liver disorders, inflammation in the body. So again, things that are kind of like getting that hotness or that heat, any kind of excess of those bile or fluids that are going on in the body. So those symptoms could also include actual temperature of heat, sometimes redness, inflammation, and something that takes real quick hold on the body. A cold illness could be something like a cold, a common cold. It could also have to do with lung or respiratory issues, and or it could do something like even depression, like mental health issues. So those things would be categorized as a quote unquote cold illness. And then to treat those things, you're doing the opposite approach. So a hot condition would be treated with a cold approach. A cold condition would be treated with a hot approach. And what that means in the food world, something like a hot category of food could be things like beef, chilies, that makes sense, right? Even things like corn husks, onions, radishes, which are kind of like spicy. In the cold category, you have things like citrus fruits, dairy products, fresh vegetables. And so when they are also talking about this balance and this approach with hot and cold or these elements, they're also looking at how the proximity to the sun, like where certain food items are procured or planted. So it's something deep rooted in the ground, or does it grow above in a tree closer to the sun? So they take that into account when they're healing, when they're treating you. So three of the healing modalities that I really wanted to focus on today, one of which is Ayurveda, as you see in front of you, but they really all have the kind of same overarching idea where health comes from a balance of internal forces, these life forces, these energies, even though some of the specific mechanisms might differ from approach to approach or from illness to illness. So, in the case of Ayurveda, if you've heard of that before, you can give me a little thumbs up in the chat if you've heard of Ayurveda. This comes from ancient Sanskrit text from 5,000 years ago, and it is also based on what's known as the knowledge of life. Again, these healing energies that come up, and also kind of like what makes our character. In the language that you see there in that fourth bullet, we have what are known, according to Ayurveda, we have what are known as the doshas. So we have again this like energy combination of these forces of life, and then we have these chakras, which are kind of these centers of energy that go from head to from up top to crown to the root of our body. And again, any imbalance in there might require a different approach of how to quote unquote heal that. It can change with diet, it can change with seasons, it can change with climate, it can change with age. So all of these things again are focusing on the organs, the fluids, those humors that I had mentioned in the past slides there. Next up, again, this is something that you might have heard of as well, traditional Chinese medicine or TCM. This also focuses on, again, very ingrained in many, many years, obviously thousands of years of approaching this, but this is also related to that kind of balance of what they call qi, that energy flow, or that yin yang, that balance, that harmony that happens within the body. There could be medicinal treatments, herbal remedies, massages, and these are known to address certain health problems. What I found most interesting a couple of things, when I was researching for this topic was traditional Chinese medicine, and I think even a little bit of Ayurveda was very, very much, there was well researched, and it keeps coming up too. So a lot of these things, you see on that bottom bullet, a lot of the things that are included in traditional Chinese medicine approaches or healing treatments or methods have been studied by the National Centers for Complementary and Integrative Health and have been shown to support people who might be undergoing either treatment in a conventional way or support them in addition to whatever they're dealing with when it comes to things like joint pain arthritis, fibromyalgia, and cardiac rehab, and even some forms of cancer like breast cancer. I skipped over that second to last bullet, the five elements. So this again goes towards what I mentioned in the previous slides with that kind of the humors and the seasonal changes in the climate, but also who we are in our body and how that kind of corresponds to hot and cold. So in the five elements theory in traditional Chinese medicine, they use these categories of wood, fire, earth, metal, and water. And that explains again how nature is a life force, how the body reacts, and how everything, this is a lovely part about this, how everything's very interconnected. I feel like when it comes to, no shame because I'm in it, to the traditional conventional medicine approaches that we take in the more Western ways here, we do lose that connection, right? It feels a little bit disassociated and it feels maybe a little bit sterile sometimes. And I do enjoy the fact that these healing properties really kind of make you hone in on and get fine-tuned into who you are, who your body is, and how you react and what all the things around you are reacting to you as well. So sometimes these approaches focus on specific organs like the spleen or the liver. Sometimes it's related to different seasons or what's in season as far as food is concerned. And there also might be things like acupuncture or different diet protocols that help with that Chinese medicine approach too. Okay, next on the list, as far as the top three healing modalities that I wanted to focus on, is something known as naturopathy. So naturopathy draws from the healing power of nature, not much different than some of the other ones I just mentioned. And as far as naturopathic doctors are concerned, they do abide by a particular order of naturopathic medicine. They have to establish a foundation of optimal health. They focus on treating the root causes of the symptoms and not just the symptoms themselves. They might focus on diet, stress management, different kinds of coping mechanisms, and also sleep is a huge thing here too, making sure we have time to rest and heal the body, kind of like quiet it down. That feels lovely as I'm saying that. They might also work in conjunction with conventional medicine too. So they might have massage therapies to offset some side effects of treatments, or they might have to work with some pharmaceutical substances and also some natural substances too. The thing about naturopathy, unfortunately, and I'll go a little bit more into detail, like I said, when it comes to like actual providers and practitioners, is the regulation on the title here and the training does vary state to state. So some states regulate the practice of naturopathy and other states actually have prohibited it. Again, I want to be respectful as I'm discussing this, but I'm just giving you the information that you may see some issues around this if you are going to a naturopathic doctor versus going to a more conventional medical doctor. So speaking of regulations and considerations, one of the things I think when I was looking through my information around this, and also just myself too, like I'm curious about these things also. I'm not against acupuncture or meditation or anything like that. I think again, the body is a very complex mechanism. And I think the reason why people do seek out these alternate methods is they want to feel empowered. Or if they've been doing something over and over and it's not working, they might get very frustrated. Or if they're having a lot of side effects that are unpleasant, they want to see how they can gain control over that. And it could also align with some of their more personal values, because I think a lot of this is in the realm of maybe religious or spiritual approaches as well. So that might feel a little bit more comfortable for them versus going to pharmaceutical, conventional, traditional methods. That said, there's some safety and regulation issues to take into account. So as I mentioned just before, you have things like quality, safety, regulation, who oversees what. So just being aware of things. Uh, Natural doesn't always mean safe. Just because something is natural or has a natural substance to it, yes, it might not be quote unquote toxic like a toxic chemical substance might be, but the potential issues around those things could be that there are naturally occurring chemical substances, especially in some of our herbs and our plant-based items, that could still interact with drugs, other foods. It could still exacerbate an allergy or a reaction to something. It could be contaminated because there's not a real strong way of regulating and overseeing those types of things like supplements, especially in America. And so, just taking into account things like that. Obviously, also, unfortunately, Some of these things you have to pay out of pocket for, and the effectiveness might be very, very personalized. So again, what works for somebody might not necessarily work for you or whoever you might be treating if you're the one doing the actual approaches. So those out of pocket expenses and how often somebody has to purchase something, again, I feel like, it depends on where they can and how they can implement whatever their needs are in order to have the best outcomes that they want. They'd have to make those decisions. So here I just want to share again some language around the evidence of things. Why some of those complementary approaches and Western modalities might use different kinds of methods. Back when I was talking about that theory of the four humors, that was a very opportunity practice based model. So people were just talking about and did things. They weren't in a lab, they weren't doing research studies and things like that. And so this really, what you see in front of you is just ways that we define and evaluate the effectiveness of how we're implementing these approaches. So yes, we have evidence-based medicine. That's what we use mostly in the Western field. In your clinical world, you're going to have lab tests and people doing retests and studies and hypotheses and making sure things work and doing different statistics on things and relevance, etc. Sometimes they'll work on animals, sometimes they'll work on humans, sometimes they'll implement placebos or sugar pills, and sometimes they'll implement actual medicines or pharmaceuticals to find out what the effectiveness is. Then you have practice-based evidence. So that's like, if I'm working with nothing but a certain clientele or certain patient population, and I'm just saying I'm working with 300 people and this is my story, or this is what I should say, what I'm seeing happen, then I could give practice-based evidence, but I'm not really using control groups or having any science behind it. And then, of course, anecdotal evidence is, this is what my family did. This is what I've done. This is what works for me. So that's like, as we call in science, N equals one. The population is just one person or a handful of people, not something that's been tested. So again, being respectful of this, yes, while some of those other modalities are not being studied scientifically, it does often overlook the fact that that's a cultural or even a religious significance practice that's been in place for so many years, long-standing traditional knowledge systems, and also those patient-centered approaches that go beyond just the lab results and things like that. Again, you're looking at that holistic version. All right, so again, if you are attending this live or have signed up for it, I've repurposed some of my content from some of my classes. You're going to see a few people on screen here that I want to share just as my fictitious case studies, my fictitious patients as they were. So you're going to meet Giorgio here. Giorgio's 74 years old. These aren't real people, by the way. I mean, they're real people in the sense I got them on stock photo. I didn't actually take somebody from my practice. So Giorgio's 74. He's got hypertension, which is high blood pressure. Giorgio might benefit from an Ayurvedic approach because Ayurveda implements a lot of things that help support his blood pressure. And blood pressure isn't just food related, it's also stress related and all these other things that are based on self-care too, adequate sleep, etc. So he could benefit from, and again, coming from a dietitian standpoint, I could implement this too, or I could work with somebody who does Ayurvedic practices and work with Giorgio and say, go work with those people on that thing and come with me and talk a little bit more about, maybe your medicines and your diet. So yes, in the case of somebody like Giorgio, a balanced diet, whole foods, plant things, being conscientious of different kinds of sodium or processed foods as well, avoiding things like, heavy amounts of caffeine, alcohol, smoking, etc., all the fun things that don't get you very far, and then helping him with some of his stress management and adequate sleep in that Ayurvedic approach. That last bullet, panchakarma, what that is again, when we're talking about detoxifying the body, we talk about liver and kidneys help regulate blood pressure. So somebody like Giorgio here, he could benefit from some of those therapies in panchakarma, which again just help him balance himself out, maybe like massage therapy or oil therapy, and promote that relaxation to just support his kidneys to do better at what they need to do. Then we have someone like Juanita. Again, she's a fictitious patient. She's 42 years old. She has breast cancer. I don't know what stage she's at, but she is undergoing chemotherapy or some treatments. She could benefit from working with somebody who knows traditional Chinese medicine because, as I said, traditional Chinese medicine, TCM, has been very well researched and studied, and there's a lot of benefits to this to support somebody, not just with obviously potentially preventing this diagnosis from happening. But if she is undergoing some of those more aggressive treatments, it can help reduce some of those side effects and it can actually help support her immune system. Because if anybody knows anything of our past conversations and some of these webinars, when you enter into some of these clinical conditions and these diagnoses, you become or I should say, immunocompromised, meaning that your immune system is not able to fight things because it's being attacked by the diagnosis or the condition itself. And then also some of the treatments are causing your immune system to be suppressed. So phytochemicals is kind of the language here that I'm going to focus on. So traditional Chinese medicine, the herbal remedies, the diets that they have that can really help support somebody like Juanita. So things like turmeric and curry powder. Again, a lot of those nice, deep, pungent type of flavors that are found in our spices and those herbs, black pepper. Healthy fats are really important too here. So things like olive oil or fatty fish. Fatty fish is just another term for things like salmon or tuna. Ginger is really healing for this as well. So ginger added into a meal or added into a tea. And cruciferous vegetables, they are known to have antioxidant properties to help with supporting and fighting and combating that cellular damage that can happen from people who are dealing with breast cancer or some of those issues that are going to end up suppressing their immune system when they're undergoing treatment. Other things like really boldly colored fruits and vegetables, anything red or purple contains something known as resveratrol, which actually helps with the anti-aging process. So again, it helps kind of healthify and youthify your body. I mentioned before healthy fats. We're talking about also things like nuts, pistachios, cashews, things like that. And also something known as diosin, which is a natural substance found in yams. Traditional Chinese medicine focuses a lot on things like sweet potatoes and root vegetables, specifically because of that, and also because of the vitamin C that's also found in a lot of these plant-based products too. So in my notes here, like I said, increasingly research has been showing that traditional Chinese medicine approaches can exhibit promising therapeutic effects that can work alongside of. So, I'll talk a little bit too in a second about kind of like some red flags. We don't ever want to make anybody think that they're going to be cured of condition by using some of these treatments, just like we can't guarantee anything, but we're talking about in conjunction with some traditional modalities. Okay, last but not least, we have our friend Amir. Amir is 58 years old. He's dealing with chronic kidney disease. So again, a kidney issue kind of similar to Giorgio, but in Amir's case, his body will be having some issues with detoxifying what needs to come out of his system. And so he can become, kind of like septic in that way. And he might also have to remove from his diet things that potentially could exacerbate his condition, like things that contain phosphorus, potassium, and sodium. And unfortunately, phosphorus and potassium are in good quality, whole plant-based foods. So if he happens to work with somebody who does a naturopathic approach, he could benefit from some of these things here too, where we'll go through some diet therapy, limiting the intake of some of those foods that I said could make things a little harder for him, and figuring out what kind of plants and other types of food products would be healing to him. They might also do some herbal remedies and to help again promote that detoxification, because that's the thing, like cilantro, parsley, a lot of these herbs and leafy vegetables can help with the process of getting rid of the not so great things in our body. Massage therapy might be a great thing for him too. Yoga, again, centering himself. If he's undergoing any kind of treatments or if he's on a lot of medicine, that could be an issue again with his immune system. Now, what I did here, I skipped over, I bolded, if you can see the bolded item there. From the research I was doing, this is the list of remedies for somebody dealing with kidney disease. However, Epsom salt. So if you know what Epsom salt, it's like actually like a granular salt that people put in a foot bath, or sometimes they sprinkle it in a bathtub and it kind of like relaxes and softens everything up and makes it nice. But specifically Epsom salt has something known as magnesium sulfate. And on the actual product, it says do not use or speak to your doctor before using if you're dealing with a kidney disease. So I find that very interesting only because this is one of those things that I want to make sure we are aware of, that we ask questions about, and that we get curious about, that we're not always just saying, okay, the provider told me this is what I should do, and so I'm going to implement it, without doing a little bit of a deeper dive and making sure that they didn't misunderstand or misinterpret one of the approaches because it can do a little bit more harm than good, and we don't want that to happen. So again, I just bolded it out there because I found it curious. It was on the list of naturopathic treatments, but that's a big no-no when you're dealing with kidney disease. All right, next up about finding some reliable information. So talking about what if you want to research for yourself or look for resources as to what you're looking at. I said not every type of CAM modality or approach is being very well researched. Traditional Chinese medicine is, but in certain respects. So the number one, number two, databases and organizations. I'm going to give me until the next slide. I'm going to share with you some examples of that. But number three and four with marketing science and these red flags, I think this, if you are curious, you might also be aware as an educated consumer, just like anything, of being asking questions or being aware of what the marketing issues are. So if you hear things being promoted like this is a miracle cure, we have a secret ingredient or a secret recipe that we're going to provide you with, and this is going to solve all your problems. Understanding, like I said before, not everything is very well regulated. So there could be cross-contamination or there could be additives in something that's not disclosed, and that could maybe have some interactions with either your medicine protocol or allergies that could potentially be triggered through some of these things. And of course, the transparency of it too. Like, why are people being secretive and kind of not wanting to share stuff? Like they should be able to tell you this is what's in it and here's what the side effects are. And, I think the language around anything, where did we do that? The nutrition facts label, right? We had that webinar a few months ago where we talked about the front of packaging is like, buy me, I'm great. I can help help you with your cholesterol levels or whatever, or it has a serving of vegetables in every portion of this cereal product. Just kind of being a savvy consumer or educate yourself on some of the language around it. Also, if any of these practitioners are discouraging you from working with a conventional healthcare provider, that could also be a bit of a red flag too, because we don't want any potential harm being done there. And then last but not least, also kind of going back what I said earlier, that this could be out of pocket expenses that are not being covered by insurance, and or unfortunately sometimes people are trying to make a buck and then take advantage of people who are being frustrated with the Western medicine approach or dealing with very complex conditions that they feel like they never get an answer to. And so hopefully this thing is going to solve all their problems, and they might take advantage of that. So again, just being conscientious and asking questions. So on screen here, I'm sure there's more than this, but on screen here are some of the more valid, legit organizations and resources that I would say if you have questions about. PubMed for sure, they have all the scientific articles, so you can, if you know how to read scientific articles, you can look stuff up on there. It is legit scientific articles, very, very sciencey. And then some of the other places do it a little bit more in lay person's terms, so you can type in a keyword, you can look up kind of like the pros and cons of approaches, and what is it, Nature Standards down there, the one on the bottom left, that one is a research collaborative. So they go through a multidisciplinary board, which means they have people from a variety of different places. They have Western medicine, clinical people, they have Ayurvedic providers, and they all share information and they weigh out the pros and cons of certain things, and they really try to look into making the best recommendations to do the least amount of harm. Cochrane Complementary Medicine, that's a review guide. I believe that's overseen by Maryland's University, if I'm not University of Maryland. And then some of these professional organizations here as well, which could provide you with some reliable sources, like books. If you're interested in reading about things like this, or you want to integrate some of this into your own practices, whether you are personally going in the direction of health and wellness as a career, or you're just curious for yourself as a patient or somebody who wants to heal themselves or help somebody heal, there's a variety of and resources and books, etc., that if you go onto some of these websites, you can do a little bit of a deeper dive and see what's up. Last but not least, though, on this list, and I hate this language, quackery and or pseudoscience. That's what comes up a lot when we talk about these alternate approaches. And I feel like the language is very harsh and a bit disrespectful. So it comes from a Western version of this, obviously. But I will say again, I try to be respectful because of the years and the culture relations to how these approaches are. That said, again, if you're curious about something or specifically like a doctor or somebody claiming to be a doctor, you can go onto quackwatch.org, type in your search words, your keywords, and find out what comes up or what information they have found. There's some guy behind here that I think just updates it like, as regularly as possible. And I think this too does have some of its critiques. Not everything's going to be perfect, obviously. So Stephen Barrett is the doctor that does all of the kind of like the reviews of all the things and tries to put together information again. Okay, give me one sec. I just want to check the chat. Yeah, thank you. Thank you again for exactly. Yeah, you were kind of talking about those categories of hot and cold. Appreciate that. So the next slide here is who is authorized. I mentioned, in my world, I'm a registered dietitian. I can call myself a nutritionist. I could call myself a health coach if I wanted to. But I am trained specifically in the clinical space, and I have the degrees and I have the extensive amounts of all of the internships and the board certified exams and the ongoing continuing education units that I have to do to make sure that I keep my credential current and valid. So, in the world of complementary and alternative medicine, you have some of the providers that we see here. I think the first four, so the acupuncturists, chiropractors, NDs, the naturopathic doctors, and the massage therapists, they do have more of a formal licensure and more of a regulated practice. Again, it does vary by state, but so does everything a lot of times. So those things they typically complete that's a big thing too, a supervised training, meaning somebody is actually watching over them to make sure that they're implementing proper procedures and that they're dealing with their patient population in a respectful and proper way. They also have what's known as scope of practice guidelines, right? So I'm a dietitian. I can't just be taking people's blood. Like I can't take a needle and like take blood out of you. I can't prescribe medicine to you. And quite honestly, I can't even give you an exercise routine because I'm not trained in exercise science. I'm not a personal trainer. I don't have the background in that. I can give you general recommendations of what the US government says we should be doing, but I also have to make sure that you're medically cleared. And I would probably end up referring you to somebody who is a physical therapist or a personal trainer or something along those lines. So that's something important too, recognizing that these providers have a scope of practice limitation, that they don't overstep their boundaries, that they know where they might have to reach out and work in a collaborative way with other interdisciplinary team members. And then the bottom ones, herbalists, yoga instructors, and Reiki practitioners or energy healers, those are sometimes known as what are a voluntary certification. I don't believe there's like a universal licensure on things like that. And there could be organizations that they go to with different types of teacher training, like yoga instructors. I know sometimes there's a 200-hour training or a 500-hour training, or some of them are done virtually, or some of them are done in an actual setting, like a physical setting where people can help with manipulating people's poses, etc. So again, these trainings, these skills, these standards can also vary state by state. So what I'm going to share with you on the next slide, I hope will help you make these decisions. If you're curious about working with people in that alternative world, then just like anything, ask questions, right? What training? How are you qualified? What did it entail? How long have you been doing this? I mean, when I first started out, I was like, oh gosh, I hope I don't hurt anybody because a lot of things I'm doing, I'm not winging it. I'm definitely putting my practice into play. But, I'm starting out with patient number one or patient number 10. And now here we are 9 years later, where I'm at like patient 5,000 and change, maybe even more than that at this point. I've developed my skills. I have done my ongoing professional development. So asking questions like this, if you want to take a screenshot of this, you can, or you can, watch the recording when you get the link to it. And then the last thing too on here, which I really appreciate, especially if they're going to be alternate approaches to healing or they're using herbal remedies, etc. How do they define success? Is it, okay, my cholesterol came down, or if I'm feeling super stressed, I no longer feel stressed, or my cancer is in remission? So, how are they doing that? In the world of dietetics, we actually follow a whole process where we go through and we assess people. We create what we call a nutrition diagnosis that pinpoints some of the priorities of how we want to set up goals and interventions and treatments for them. And then we constantly meet with these people over and over again, or as often as their insurance plan allows, to make sure that we're monitoring and evaluating what's going on. So does it take time? Sure, some things take time, some things can be quite quick. So again, just asking some of these questions I think is quite helpful in allowing you to be a better educated, quote unquote, consumer. A trustworthy professional of any kind. I'm thinking right now of some people I've met in my past as my own, like me being a patient and them being doctors, but a trustworthy provider of any kind will welcome these questions. They want you to be put at ease. They want you to feel comfortable and confident in what they are providing you with. And they're all sticking within their scope of practice as well. They encourage collaboration. I do this all the time. I don't specialize in things like eating disorders. I said I don't have an exercise science background. And I might also work with patient populations that require medicines or treatments another way outside of conventional medicine, but also alternative medicine. So I might say, put me in touch with your psychiatrist, put me in touch with your cardiologist, put me in touch with your Reiki healer. Let's make sure we're all kind of talking the same language and then we're supporting you as the patient as best as possible so that you're not getting stressed out that everybody's doing something different and it feels very conflicting. So again, do your research, ask your questions, and look for any potential red flags or marketing, quote unquote, ploys that might come up in that space. All right, next up, I want to share with you some of my own personal suggestions, recommendations, just things I like to share. Divya Alter, I love her so much. I ran into her once in a conference and I totally fangirled and I didn't go up and say hi. And it's so dumb because we're just people, but I felt like she was a celebrity. So Divya Alter and her husband founded an Ayurvedic culinary training program. And I live in the East Village in New York City, which is in lower Manhattan, the borough of Manhattan. And she has a restaurant there and it's actually an Ayurvedic restaurant. Like you go in there and you say, I'm feeling hot or cold. And she's got a menu that speak to those doshas, those like forms of energy. And listen, whether it works or not doesn't matter. You get in there and it feels super cozy. It's such a delightful experience. So I highly recommend if you're ever downtown in the East Village, Lower East Side, they're on First Avenue and like right up, I think, First Street or so. So it's Divya's Kitchen. But if you can't make it in person or you don't feel like traveling there, she also has a website, divyas.com, and she sells some things. She sells like herbs and teas and things like that as well, because again, it's part of her culinary training program. So I really, really love her. I go here about twice a year. It's a little pricey, but listen, it's worth it sometimes. Okay, next up, my dear friend, Kimberly Ashton. Her website and her company, her organization, her practice is known as Qi Food Therapy, right? Qi, I mentioned before, the traditional Chinese medicine, the healing, balance, life energy. And as you can see, she even has a picture of some of those root vegetables and mushrooms, very big in some of those remedies too. She's actually based out of Australia. She has some really good, especially for women's health. Like I just attended one of her menopause discussions and it was fairly affordable. It was like maybe like $30 or something. And we had like a 2 or 2.5 hour workshop. I liked it very much. Obviously, she's in Australia, so the time difference, I forget what it was that she was, I think I was up at like 5 in the morning to meet her time zone because what is it, 15 and a half, 16 hours ahead of the East Coast. But I love her and she has a lot of great resources. She has a good kind of like platform on Instagram too. So I highly recommend checking her out if you want to get a little bit more information about traditional Chinese medicine. And here is Zoe Gong. I'm so proud of her. She's actually a former intern of mine way back in the day. She has written a book. She does food demos. She is a traditional Chinese medicine chef. I think when she lived in New York City, because she's based out of Shanghai too, but she travels all over the world. And I think in her apartment, she had something like 150 varieties of mushrooms and dried herbs in little jars in her apartment. And she would bring people over to have dinners. Like you'd pay a price and you'd hang out with her, and she would give you a healing dinner based on traditional Chinese medicine approaches. So again, things like this, I think, just really go well hand in hand, especially if you feel somewhat disconnected or not feeling grounded anymore to those earthy qualities or kind of missing who you are on a more holistic self-care spiritual level. I think this would be kind of a good thing to share and check out Zoe. And then last but not least, on some of the people that I personally know, this is Dr. Renata Shaloa. So she's a registered dietitian. She was my preceptor. So she oversaw my training as a dietitian. And then I was also working for her for 2 years at the Lower East Side Health Center where she was working at too. She runs a private practice. She went back to school to be an integrative and functional medicine doctor. And she's also a yoga teacher. So she definitely, this is what I like about that too. it's not like she's just going in one direction or the other. She's purposely combining things so that she can provide the most amount of guidance for people who might want a little bit more support in both the conventional and the alternative approaches. All right, my friends. So at the end of every webinar, which it is coming up on that time, I always like to just ask you a little bit about, what are some of your takeaways? Do you think this is something that, especially at the end of the year, as we enter into the new year, do you want to start focusing on some healing things? Do you want to jazz up your repertoire a little bit? Do you want to check out some of the resources I gave you? Are you interested in any of those alternative approaches? You don't have to answer here, but just kind of, getting an understanding of what to do next in your stages of your health and wellness journey, what goals you see for yourself, if there's anything you want to start doing. If there are things you're already doing that are serving you and you like doing and you're consistent at it, do you want to keep on doing that? And if there's anything that's not serving you anymore and you want to kind of put a stop to that, then you can recommit to yourself right now if you want to do that. So our next webinar, which is going to be in the beginning of January, is going to, yes, I'm doing it. I'm just going to latch on to the new year. I'm not fighting it anymore, but we're going to take an approach of a reset. Again, we're going to kind of like recommit to some things. I'm also going to start doing handouts because I don't usually do a supplement to these webinars. I just give you the stuff, the presentation recording, and we're done. But I'm going to do a handout for this one, and we're going to do like a little in webinar activity or like a mini workshop within this discussion. So if you're able to make it, when you get the recording and the thank you email from this event today, I'll send you the link to register for that. And I'd love to see you there, or you can share it with people that you want to share it with. And I always like to share too. I mentioned before about our playlists and stuff. I have a very robust YouTube channel. I have podcast episodes on there because I've interviewed over 150 people from all walks of life. A lot of them do some complementary and alternative healing modalities too. So I'd love for you, just to go find free stuff out there. And I feel that this is good stuff, that good quality stuff that I'm putting out there. So feel free to check out the YouTube channel, subscribe, share it with others, and feel free to leave a message, leave a comment if there's anything that resonates with you. I also have a private practice. So if you or anyone that you know of wants to work with a registered dietitian, I do see people 100% virtually, telehealth only, HIPAA compliant platforms. I do take a wide variety of insurances, and I also can work with people across certain state lines, not all of them, but I think there's like 10 different states that I can work with, like California, Michigan, New Jersey, New York, et cetera. So there's a lot of places that I can work. I've been doing this for 9 years, coming up on 10 years. I think I'm really good at what I do, but if we're not a good fit, I'm always happy to listen to what your concerns are and then refer you out to someone else who might be a better fit, who can help support you. Lastly, I just want to go through because, like I said, research, however it is defined, the value that's added, the science behind all these things, the amount of effort and energy that people put into things to really help us understand what is out there, what exists, what is legit. So all of these slides here are all of the things that I've looked into or I've had people help me look into to help put this webinar together. So on that note, we do have a handful of minutes left. I'm happy to answer questions or just say thank you to all of you for being here. And I hope we see each other again soon. As I said, there's always dozens of people that sign up for the registration, a handful of people that show up live. So if you're attending live, thank you so much. If you're watching this as a recording, feel free to engage in some way, shape, or form through the comments, or you can send me an email. Far says those people who don't have kidney disease. Yeah, so Epsom salts are usually okay, Far, but you'll see on the packaging, it usually will say something like warning. If you have this particular thing, don't use it. Hold on one sec. I actually want to answer that a little bit better because I wrote down what the contraindications were. Kidney issues, hypermagnesia is technically the cause of it. Oh, so it can exacerbate respiratory, cardiac, and neuromuscular issues specifically for people who are dealing with kidney disease. So that's the information I wrote down because I was focusing specifically on kidney stuff. But on the warning label, again, just being an educated consumer and checking out what the warning label says as to who should not be using this, or check with your doctor first. Are there things that I'm taking in my system or other medicines that could potentially counteract with that magnesium sulfate or whatever it's called. Yeah. Thank you so much, everybody. You guys, thank you so much for being here. I really appreciate your time. If this is the first time that you've shown up, I really appreciate that too. I try to do a wide variety of topics, so it's not always just like clinical stuff. Sometimes we do food related things. Sometimes we do general health stuff. Sometimes we do mindful approaches. And that's what the surveys are for. Share with me what you find interesting and I'll make a webinar for it. Thanks everybody. It was a pleasure seeing you and I hope to see you again soon.